Okay, so in community health, today we will discuss about home visiting. Okay, home visiting is very important aspect of community health nursing. Okay, when we provide service, we have to visit the households and we have to provide domestic nursing care also. Okay, so what is home visit? A home visit is a family nurse contact which allow the health worker to assess the home and family situation in order to provide necessary nursing care and health related activities. Okay, it means it is a family nurse contact because in community health we consider the family as a unit. Okay, because each member have effect on the health of other member because they are staying in a common household. Okay, that's why in community we consider the family as a unit. So when the client come in the center, that client may be individual or he may accompany one member of the family. But when we visit home, then the whole family will be there and we can meet them, we can assess their health needs. Okay, that's why it is important. Home visit is defined as the process of providing nursing care to the patient at their doorstep. Okay, and that's why it is also known as domiciliary nursing. Okay, so in exam the domiciliary nursing, what is domiciliary nursing, this may come or define the home visiting. Okay, so both are same. It may be domiciliary nursing or home visiting. Why we go for home visiting? Why it is important? Okay, so what are the objectives of home visiting? Okay. And many time in exam this question comes, that write objectives of home visiting, yeah, goals of home visiting, anything they can ask. So first important objective is to assess the family as a unit and as individuals. Okay, it is a group of individuals, so we go to assess the health status of family as a unit as well as individuals. Second, to observe the family in its real situation and environment. Okay, how they live in their household, what is their environmental conditions, and we can easily assess when we go for home visiting, otherwise we cannot assess. Okay, by just asking we cannot find out. When we visit, we observe and we can find out the actual condition. Then to give teaching and advices in their home environment. Okay, so when we visit the home, we can provide health education in their home environment because the client is in the home environment, he is relaxed and he can easily understand what we are saying. Okay, next, to give each family member a chance to raise question. Okay, it is also important objective because in the clinic only one or two member will come for a particular disorder or problem, but when we are visiting home, they all will be sitting and they can ask the question related to their health problem, own health problem or the other members health problem. Okay, so interpersonal relationship are increased or will become better. Then we also visit the home to collect health information and survey. This is also an objective. Okay, to collect data, we visit the home. Then to identify the needs of each family member. Okay, individually as well as for the whole family, we can easily find out the needs. Then we visit the home to observe nursing care given to a sick member at home. Okay, if a person is discharged from the hospital and we ask family members to provide a particular nursing care for a few days, then during home visit we can find out that particularly how they are giving the particular home care nursing. Okay, so we can to observe that we can visit the home. For example, if we have asked the client that for few days you have to care the skin to prevent bed sore. Okay, so by visiting we can check how they are providing the care. They are providing care properly or not. Okay. Then to identify health hazards and problems that cannot be dealt during the clinic visit. Okay, many times we can find out the root cause of problem the particular family is having, but by visiting home we can find out the environmental conditions which may affect the disorder. Okay, so this is an important objective, that we can identify the health hazard or cause of a problem. Then to identify high risk family member and refer as needed. Okay, sometimes the person who is at risk is not visiting the clinic. Okay, but especially older age people or teen age people, they are having problem but they are avoiding the clinic visit. So during home visit we can also identify them, their problem, and we can refer them. Okay, then to provide antenatal visits and antenatal care. Okay, it is also important aspect that during home antenatal service, few visits should be based home based. Okay, otherwise they will come to clinic, but 1 or 2 home visits should be there to provide proper antenatal care. Okay, so to provide antenatal care we can visit. Along with this, to provide postnatal care, we also visit the mothers after delivery. So it is also an objective, and for surveillance in case of spread of any communicable disease. If there are chances of spreading communicable disease, then we go for surveillance, that how many household are having that particular disorder. Okay, so these are the main objectives for home visiting. Now we come to the principles of home visiting. This will be the another question which may come in examination, that write the principles of home visiting. Number 1, the home visit must have a purpose or objective. Okay, all the home visits should have purpose. Without purpose we should not visit a household. Okay, so first we have to find out why we are visiting the particular home. Then planning for home visit should make use of all available information. So whenever we plan a home visit, first we should use the available resources. What are the available resources for home visit plan? The family folders or record of the family which are kept at our center. Okay, by which we can find out the what problems may be there in the family. Okay, or any record which is kept we can find out. Okay, so for planning we should use the available information. In planning for home visit, we should give priority to the essential needs. Okay, so priority wise we should go. For example, if on a particular day we are visiting 5 families, then according to our record we should find out which family need urgent care. Accordingly we will first visit to that family and then to another family. Okay, so priority should be maintained as per need, okay, of the family. Then planning and delivery of care should involve individual and family. Okay, whenever we plan, before going we should involve them. How we can involve? Nowadays we are having facility of mobile. We can call that today we want to visit, will you be available or not, and what are the possible problems for which you need help. Okay, so these days we have more facilities for involving the client. Okay, we can involve them, we can plan accordingly that at what time we should visit, at what time you all will be available. Okay, in this way we can involve them. Then the home visit plan should be flexible. Okay, it always should be flexible. Whatever we have planned, we should be able to change when we visit the family as per need. Okay, it should not be rigid, should be always flexible. Then home visits should be regular. Okay, weekly or monthly or bi-monthly. For example, if we have visited one house and we have after that we have not visited the house for many years, then this is not proper care. Okay, we should visit regularly. If the village is big, then in 2 months we can visit a particular house. Okay, so every 2 months we should visit the whole village. Okay, so this should be the regularity. Then home visiting should be convenient to the family. Okay, so before visiting we should make plan. We can involve them that at what time we can visit your home. Okay, so every home visiting should be as per convenience of the family. Okay, then next principle, home visit should serve as demonstration session for the good hygiene. Okay, so whenever you visit, you should also maintain a good hygiene and should demonstrate good hygiene. Okay, if you are visiting a particular home, before every procedure you are washing your hand, then they will also learn that for every activity you should maintain hygiene. Okay, and you should wear good uniform, clean uniform, so that they will understand, okay, yes, whenever we visit somewhere we should keep ourselves clean. Okay, so this you should maintain. Then the home visiting should be an opportunity to develop IPR. Okay, whenever you visit any home, you should develop good IPR. Okay, you should talk politely. Okay, in a friendly way, so that interpersonal relationship between you and family becomes stronger. Okay, and then they will listen to you, they will understand what you are saying. Okay, then home visiting should be educative and informative in relation to health. Okay, so as we have discussed already, every home visit should be with the objective, and one objective is this, that whenever we visit it should give something to the family. What it should give? It should give awareness to the family, it should give knowledge to the family in relation to health. Okay, so this is also a principle. Now, what is the home visit plan? Okay, sometime it is asked in examination, prepare a home visit plan for family or the individual. Then we should consider the following thing, that family health record including family folder. Okay, whenever we are visiting a family, we should keep the family folders with us. Okay, or any information which is we are keeping in our center, we should keep it with us. Okay, if we are visiting 5 families today, then 5 family folders should be with us. Okay, so number 1, we should keep the family record. Second, map of the area. Okay, we should have full map of our particular area or villages in the sub center. Then addresses of the family to be visited. Okay, if we are visiting 5 families, so 5 addresses, 5 family folders will be there. And then micro plan, which include route from the first family to last family for a particular day. Okay, so for home visiting we should make a micro plan, that first we will visit to this house, then we will go to this house, like we are making in the pulse polio program. Okay, so same type of family micro planning should be there while visiting the home. Then home visit plan format. Okay, we also prepare a format for particular family. If we are visiting 4 family, then we will prepare 4 formats like this. This is a format for 1 family, that identification data has to be right, address of the family, name of the head of family, total members of the family, and date of home visiting. Okay, then we will fill this table. It contains 4 columns: assessment, planning, implementation and evaluation. Okay, so first these 2 columns we will fill while planning. Okay, assessment and planning. We can write. How we will write? After watching or understanding the family folders or the record which is kept here in our center. From those record we can find out that what possible problems will be there in the family when we will visit. Okay, if we have seen through our record that there will be one ANC, okay, and there may be some senior citizen people having a particular disease, communicable or non-communicable. So this we will find out from our record and we will write in the first column. Okay, about antenatal case, then senior citizen having disease, this we will assess from our report, and accordingly we will make plan that what we will do. Okay, for antenatal mother what we will do, and for senior citizen having a disease what we will do, we will write in the planning format. Okay, these two columns we will keep empty and we will fill after visiting the family. Okay, what are those columns? These are implementation and evaluation. What is the meaning of implementation? That after reaching to the family, what we did there, we will write in the implementation, and then after providing the service or after implementation, what was the effect, that we will write in the evaluation column. Okay, so two column we will fill before visiting and two column we will fill after visiting. Okay, so this is the home visit plan. Okay, after these preparation we go for visit. And what are the techniques of home visit? Another question comes. Technique means what steps you will do there. So first of all, we will greet the patient or family and introduce ourselves. Okay, that we are from that center and we have come to provide some health related information to you or care to you. Okay, be polite and friendly in approach. Okay, state the purpose of visit, that why we have come, and be ready to change the plan of the visit as per family need. Okay, as we have discussed that the plan should not be rigid, it should be flexible, so we can change it according to the need of the family. Okay, if we are reaching there and we have seen that there are some guests, they have reached here and they are busy, then we can plan accordingly. We can ask them that okay, we will come after 2 hours, first we will visit other houses. Okay, in this way you can change your plan. Then after entering the house, you just observe environmental condition of the family, that if there any environmental problem which is affecting the health of family, so you can just observe at a glance. Okay, then ask for suitable place for bag to put. Okay, so whenever you visit, you should keep a community bag with you on your shoulders, and then ask the family that I want to keep this bag where we should put. Okay, they will tell okay, on the chair, on table, and accordingly you can use that and place your bag there. Okay, put the bag in a convenient place and then proceed to perform bag technique. Okay, then using the bag you can provide your services, and how you are using your bag, that will be a separate lecture we will discuss in next class. Then observe the patient and determine the health needs. Not only patient, each member of the family we will check them, assess them. Okay, then perform nursing care needed to give health education. Okay, both we should do. If health care is needed, then we will provide health care, nursing care, and if there is no need to provide any care, then we will provide them health education. Okay, or health awareness talks. Then we will evaluate the nursing care given. Okay, we will provide health care and then we will evaluate. Okay, and this we will write in our plan, implementation, what we did there and what was the outcome of that health talk. Okay, for example, if we have given health talk, then how we will assess, how we will evaluate? We will ask them questions. Have you understood about this? Okay, if they have understood, it means good outcome. We can write there, yes, they have understood what we told to them. Clear? So this is the evaluation. This we will fill in the format. Okay, and after filling, then we will ask them bye bye. Our next visit is expected on this date. Okay, that we should tell. So this is all about health. Okay, home visiting.